Well, we could be in for a severe flu season with a deadly strain spreading through the U.S. The most common strain began mutating shortly after this year's vaccine was created, making it less effective than in previous years. Widespread cases now reported in 36 states, according to the CDC. And so far, they say 15 children have died from complications of the flu. Dr. Devi Dr. Devi is here, and she's the assistant professor of anesthesiology and rehabilitation at the NYU School of Medicine. Thank you so much for joining us.
It's good to be here.
Nice to see you again.
Yeah.
So we are, halfway through the flu season, and many people are already calling this an epidemic. Is that word too strong, and what do we need to do?
Well, it's hard to know, it's hard to know exactly, because one of the strains, the one that seems to be causing the most problems, we're not protected against that by the vaccine. So that's the real concern. But we don't know how the vaccine is doing against the other strains. I mean, so far at this point, it seems that more people are being hospitalized compared to the past couple years. But we don't know in terms of deaths and the other complications how things look yet. Unfortunately, you only figure out that data after it's done. Mm-hmm. The things that we can do, I mean, there are a couple things. In terms of vaccine, I still think it's worth getting the vaccine if you haven't gotten it. Mm-hmm. The reason is, it's kind of like if you're going into battle, like in medieval times. If you have armor, of course you want to have armor all over. If you just have it on the top or only on the bottom, it's still better than not having it at all.
And even though we're midway through the season, it's still not too late to get it.
No, it's not too late. And pretty much everyone should get it, except kids that are between the ages of 0 and 6 months, because they're not ready to be able to get that vaccine. Okay. If you're pregnant, it's okay to get it. And if you have other medical problems, you definitely want to get it. I mean, my concern actually, aside from the people who'll get flu potentially this year, I mean, my concern is for the future. If people get the flu vaccine, let's say, then they get sick. They're getting sick because they're not fully protected, not because the flu shot actually made them sick. But people may worry about that.
They do worry about that.
Yeah.
I worry about. I got the flu vaccine this year,
yeah.
And I actually asked my doctor. I said, well, is that going to give me the flu?
Yeah.
And it's not true.
It doesn't, because the shot does not give you the flu. So the shot actually has a dead virus in it. So there's no way that you can get sick from it. So if you do get sick, it's most likely because you were already exposed to the flu beforehand, and then the shot didn't protect you. But with this kind of mismatch this year, the forecast being off a little bit, the problem is in future years people may, have a negative impression of the shot.
15 children, though, so far have died from this strain of the flu. And that you can compare it to last year. Over the entire season, 109 children died. I found it interesting that they don't keep track of the number of adults who die from the flu, though, every year. Yeah,
I was surprised about that, too, because you would think that we would want to have all that data. I mean, I think part of the reason might be because it's complicated in adults. Like, who are the people who are most at risk to have these kinds of complications? It's people who have other medical problems. So either they have asthma, maybe they have heart or lung or kidney disease. So you don't always know if it's the flu that killed them or if it just tipped them over in terms of their other medical problems because their body's busy fighting a lot of different things.
Now, we're told that the strain of the flu mutated too late in the season for them to be able to do a new vaccine that would cover this. Is there any way that they can avoid this next year, taking a look at what happened this year?
Well, it's hard. So they have in the past, right? So they've been able to control things pretty well with the flu vaccine. I mean, we're talking about deaths, which are awful, of course, but in the past, you have to remember, flu has actually killed, hundreds of millions of people. So it's a vaccine that's protecting us. What they can do is they can take the data from this year and try to figure out something that would be better for the future. But it's kind of like a weather forecast, or when we talk about stock prices, like you were earlier. You use the best data that you have and then make your estimate. But it's hard to actually get it right because they have to start usually around January or February to have the vaccine ready for the next year.
So as always, talk to your doctor, and we're saying that it is best to have some protection versus no protection at this point.
Exactly. And if you have any symptoms, see them right away because they might be able to give you some antiviral medications.
Dr. Devi, thank you so much. We appreciate it. As always, Happy New Year.
Happy New Year.
Yeah. Trace?
Well, we are learning more about the victims of the Air Asia crash.